the heck would I talk to a speech-language pathologist or SLP about concussions? This is a familiar question I'm often faced with as a medical SLP. On this particular occasion, it was an orthopedic physician asking me as we stood shoulder to shoulder on the sidelines of a high school football game. Nobody questioned why the ortho doc was there, or the athletic trainer, or the physical therapist. But me, the SLP? Doesn't she teach children how to say rabbit instead of wabbit? We are cognitive rehabilitative experts. We help stroke patients to speak again. We help dementia patients remember a little longer. And we treat concussions and traumatic brain injuries, or TBIs. And that's why I was on the sidelines, which turned out to be a good thing because not 5 minutes after my spiel, crack! A helmet-to-helmet collision took place right in front of me. The player, who was obviously concussed, was about 110 pounds soaking wet. The momentum from that hit caused him to roll onto the sidelines, literally 3 feet from me. I was startled, nervous even. I've seen a lot of things in my profession, but to witness someone's brain get concussed a few feet from me was a first. This was someone's baby. I saw his eyes roll around in his head like 2 uncoordinated marbles. When he tried to stand, his knees buckled, and the assistant coach reached out to grab him just as he fell forward, while simultaneously pointing and asserting, "I can go back in, coach." When he tried to take the field, with each step, his legs wobbled like a newborn baby deer toward the goalpost. Soon after I'd learned that young man had been cleared to return to play from a concussion 1 week before. Based on what I could assess in that split second, I prepared an immediate no for the question I knew was coming. After the orthopedic physician, athletic trainer, and physical therapist did their thing, assessed for balance, asked a few questions, and determined that since he wasn't a senior, it was fine if he went back to play. I thought, what does him being a senior have to do with whether he'll play or not? They looked at me. So, what do you think, Doc? Do we send him back in or do we bench him? I couldn't believe it was even a question. No, I said. He failed the memory and balance test. He was just concussed. It's too dangerous. He's at risk for SIS. SIS stands for Second Impact Syndrome. This can happen when someone sustains an additional concussion or concussions before the initial injury has had time to fully heal. The brain tissue can swell so severely and rapidly that it begins to push through the tiny holes of the skull. SIS has about a 50% morbidity rate and a 100% chance of permanent disability. We were deep in a football over everything culture, and football over safety is the way they played the game. When the orthopedic physician told the young man we were keeping him on the sidelines for his own safety, the player stood up, hurled his helmet, kicked the metal bench he was sitting on, and walked away. It happens. But I'd rather have a mad athlete than a dead athlete. Most people don't know the number 1 cause for brain injuries isn't sports. It's falls. Number 2, car accidents. Most brain injuries happen to ordinary people on ordinary days. People like the patients I treat. And we'll call this particular patient Tiffany. And on a Monday afternoon, Tiffany stood in judge's chambers, holding the case file she'd reviewed just the day before. But as she scanned the pages, none of it made sense. She couldn't remember the plaintiff's argument. She confused the defendant's name with another case entirely. This was a woman known for her steel, sharp precision, and now was unsure of what was before her own eyes. She paused, gripped the edge of her desk, and for the first time in her 20 years as a judge, felt fear in her own courtroom. On one ordinary morning, Tiffany was driving to work when she was in a minor car accident. No sirens, no hospital stay, just a few scratches and a bump on the head. She walked away feeling lucky. But within weeks, something was wrong. She wasn't herself. She began mixing up legal terms she'd used for decades. Names slipped away. She was exhausted all the time. It eventually became too much. So after much deliberation, she decided to step back from the bench and asked for help. But doctor after doctor after doctor told her the same thing. Probably stress, maybe depression. Let's put you on an antidepressant. It didn't fit. But trying to explain herself became so exhausting, she eventually gave up. Tiffany's story teaches us that a bump on the head doesn't have to be traumatic to cause significant injury. You don't even have to lose consciousness. And not all brain injuries show up on standard imaging like CT scans. Most brain injuries don't happen in stadiums or on fields or on courts. Who here has been in a car accident or knows someone who has? Brain injuries can happen in car accidents, in falls, in military service, in domestic violence, in ordinary lives. In fact, according to the CDC, approximately 5.3 million people in the US live with a long-term disability related to traumatic brain injury. Some symptoms show up hours later, or days, or weeks, and in some cases, even months after the initial injury. And when an injury is invisible, it is easy to misinterpret, easy to cause stress or depression. After more than a year of struggle, Tiffany made the difficult and heartbreaking decision to retire from the bench. So the next time someone says they don't feel like themselves after getting a bump on the head, whether it's a 110-pound kid on a football field or a 20-year judge in her courtroom, pause before thinking to label it as something else. Don't reach for the easiest explanation. Ask one more question. Push for one more answer. The most powerful thing you can do is refuse to let an invisible injury stay invisible. Today, Tiffany is doing well. She eventually built a medical team to help her understand what happened to her brain and to heal. Tiffany's story encourages us to widen our lens. Some of the most dangerous injuries are not always the ones we can see. They're the ones we can mistake for something else. Thank you.